Kim Lynch and Spring Lane.
I'm Kim Lynch, CEO and founder of Metis Health Technologies. With over 20 years in health tech, I've dedicated my career to leveraging data and technology to enhance patient care, empower clinicians, and advance the quintuple aim in healthcare. At Metis, we push the boundaries towards a fairer healthcare system symbolized by our emblem, a bee, inspired by Marcus Aurelius. What injures the hive injures the bee. One of my earliest memories, happily twirling in a chair at my pediatrician's office, sparked my passion for ensuring everyone has access to care that treats them as individuals. At Metis, we're on a mission to enable this kind of care in every community. Today, healthcare is out of balance, primary care is under threat, and many healthcare businesses are unaware of key aspects of their operations, worsening workforce burnout and hindering engagement and satisfaction.
Hi, friends. I am Spring Lane, the steward of exceptional wellness. At EW, we are reshaping healthcare, the whole industry, through our direct care network. Our mission is magical, and not only because of our collection of dabbing unicorns and rainbows, but because we educate, equip, and empower people to be exceptionally well. We tell people every day how awesome they are until they believe it, fulfilling our purpose to love folks exceptionally. Together, we invite you to join our journey as we discuss innovative ways to revolutionize healthcare, whether it's breaking down complex topics, sharing success stories, our tiny joys, or exploring new methodologies. We're here to make sense of it all. Share your thoughts, topic suggestions, or success stories at beesandunicorns.com. We cannot wait to hear from you.
Why are we doing what we're doing? Not just our why, you know what I mean, but our podcast why.
That's really what I've been trying to jot down as I've been thinking through this. And for me, it is accelerating others to take on wherever they are in the journey, the next step. So if they're non-contemplative, curiosity. If they're trying some new things, keep trying them, talk with others. If they've got a little, slack, a little excess, awesome. Join your voice of how did you create that space for yourself, for your patients, for your community? I think that, for me at least, it is the pebbles. It's the tiny, did we make this patient, this clinician feel better about the care that they received or provided tomorrow?
Yeah.
That's the measure of success for me. If we're making things make sense,
right?
Or yes, demystifying things that shouldn't be mystical or shouldn't be gatekept, we are also making it easy, right? These concepts that feel like they're out of reach, they're not so approachable. Ask us more questions if we haven't made it approachable enough. That is our stated purpose. And we want people to feel good about, I think, things like efficiency and optimization. They're not diametrically opposed. Those have been co-opted by the money people. Don't let them, right? Optimization, improvement, all of those words mean you get to hold your subjective definitions of what good looks like as a clinician, your subjective definition of what health feels like as a patient. And as long as we're holding space for the real, the individual, the big, and it gets to feel how you want it to feel.
Yeah.
What feels right to you.
Yeah. And for me, also thinking about it, almost if you ever watch an ant colony being formed, right? And they've got, it's just overnight, there's just all these little things, a whole big community, right? And they're all working together and they have this whole big goal without really a whole bunch of, I don't know, it doesn't seem to have a lot of drama to it, right? It just happens, right? And that's what I kind of want to do with this whole, make it make sense. I just want people to pull them out just a little bit so they can kind of see what we're building, because we are building something, right? We have a system. Yep. So we are constantly building something, whether we are aware of what we're building or not. And I just want to help so bad for us to be okay, what are we building? Because we are building something.
I think that is exactly right. That willing to be patient with the practice of things and to zoom out and say, I am participating in this with my time, right? The time. Where does the time go? Are you putting your time towards mediocrity, keeping the system in place? Are you putting your time towards getting a paycheck there and figuring out what else you might be able to do other places? Wherever you are, no shame. But the point is to make that unconscious, where am I putting my time, conscious?
Yes. And like you said a second ago, how do you want it to feel? Right? So if I, as a provider, as a clinician, really ask myself, what is it that I want? What do I want for my day to feel like? What do I want my patients to feel like? What do I want my employees to feel like? When I ask those questions, I have pretty clear answers. Like, I know I want myself, my team, and my patients to feel alive. I want them to feel worthy, and I want them to feel liberated. Those are the three things that I just so much want for people to feel, right? And so if I work backwards from that goal, and I think a lot of us go and do the thing that we're doing in the system, right? And we have I want them to thing, but we aren't ever taking the time and saying, is what I am doing today in that lane? Am I in that space, right? Am I making them feel alive? What am I doing right now that actually contributes to that? Am I holding space for what they need to feel worthy, right? And so I have to be intentional about that, because it doesn't just happen, right? It has to be intentional.
Well, I'm picking up on something that you and I have talked a lot about, is that triage, right? Of, well, what is most important? What is least important? Maybe there are lots of things that are important, but we can force rank them. We can say this matters most, this matters least, or first, second, third. And when we do that, and we're real with ourselves of how did I show up against that stated purpose, right? This is why you and I are doing this exercise, right? What are our reasons for this? Are we matching up against it? If you do that, I mean, this is literally the Simon Sinek thing, right? And why we're starting with why is it allows you to check in and say, hey, I said, we said we're operating in alignment with these values. How did we do today in walking that walk? It's not theoretical. It's not some distant thing. It's, did we put points on the board, right? Just compounding interest is the idea, but being a cautious compounder, right? Like, not going for radical stuff, but looking for what are the little things today that can reduce friction on my patient, on their care team, on myself. What can I do to bring a little more joy, a little more dignity to myself? And when I'm a little more full, I can bring more to others. Like, I hear it so much, Spring, in, again, we've talked about this for years. What can you do? What matters to you? Rank it. And then I'm not saying it needs to look like anybody else's, but what is possible? And then those tiny pebbles, right? Those little bits compound over time into super big change. But it is that alignment of, what are my values, and am I practicing it, I think, in the daily that we're talking about.
Yeah. And I love that as we think about, like, make it make sense, right? Because so many times, you and I have talked about these things, and, like, I think that we're not wrong in assuming that, you talk so much about the quintuple aim, right? So I would love for you to define, what is the quintuple aim, Kim?
So the quintuple aim started out as the triple aim, is how a lot of people first met it, coming out of the Institute for Healthcare Improvement and Dr. Don Berwick. It has since been updated to the quadruple aim and now the quintuple aim, but it's one of my favorite constructs in healthcare. So if folks want us to go into more detail, rest assured, quite frankly, we're going to do it anyway. But I would actually love to know, where people have questions about the quintuple aim as we share, our vision of how we're using it at my company, Metis Health. But everyone is using the quintuple aim. That's really the magic of what IHI gave us in the triple, quad, and now quintuple aim is I think of it as a lingua franca, a common tongue, an ability to say, who am I caring for? How well am I caring for them? What does it cost? Because money's neutral, or at least it should be in this part of the conversation. What's the engagement of everyone in the system, the patients, the clinicians, the teams, the caregivers? And lastly, equity. Where could I serve my immediate patient population better? Where are there quality gaps or utilization gaps? And really, beyond the walls of my clinic today, where could I serve my wider community? So to me, as an organizing framework, I love the quintuple aim. And just like we're talking about of alignment of values, it gives me a really quick check to understand, where am I putting points on the board, if I'm putting points on the board, and how another organization or clinician or healthcare operator is similarly trying to show up and put points on the board. How do you think of the quintuple aim?
Yeah, I love that. Well, I mean, I got introduced to it as the triple aim, right? And then, I was thinking about that this morning as I was just journaling, and I was thinking about, how many times that we sat in front of different clinicians talking about, oh, good for patients, good for practices, good for society, or good for, all of those things. And I'm like, and that's great, right? in theory. And then just like what you were saying is like the whole make it make sense is like, okay, well, when we look at the actual case studies, right?
Practice, the day-to-day practice. Yes.
They're the real, right? I know that, I love research. I'm a researcher, but like when you're talking about a research project, right? You're repeatable. That's so great. We've got everything controlled, but that's not real life. It's not real life for anyone, right? And I don't care how rigorous you are and how you set up your study. There are always, assumptions that have to be made. There are always variables that you can't control, like especially with humans. We're too complex, and which is amazing. I think it's what makes
Which is amazing. Exactly. I think that's the beauty of it as an operations person. I'm like, the crazier, the better. Like, give me something I've never done before. If we design in healthcare in a sterile environment, then it's going to immediately be less applicable when it hits the real world and all of the things you're talking about.
Well, and exactly what you were talking about with the quintuple aim about equity, right? So that's the thing that I love about case studies, because I feel like whenever you connect to a story, right, you can tell in the different environments where that story aligns or doesn't, right? When you're looking at a study, it's, I think, harder sometimes because it's not a human. I think that, we understand people in stories, right? And that's how we've taught for, ever, is through
Forever. Yes.
And the point is because we can remember that. We can remember the grandma or whatever.
I'm going to ask you, good morning. What is your tiny joy today?
My tiny joy today. So my friend Kelly is amazing, and my house is getting remodeled, and she's been letting me stay at her house a lot. And she is like, she's got such a servant heart. She like washes clothes for me and does all these sweet things. And she brought my clothes to the clinic yesterday, and I was putting them in my car, and I'm like, oh my goodness, where are these little socks? And I remembered it was for my grandson, and they just made me so happy just to see the little feet. And I'm like, oh, that means I spent time with one of my grandsons. And it's just like the best. So tiny socks, that's my tiny joy today.
That is a perfect tiny joy. Baby socks are the best thing ever. Like, I can't part with them still.
It's just like, oh,
The best. I love that. All right, so now it's my turn. My tiny joy this morning. I'm getting ready for a road trip actually with my kiddos, and that's going to be fun. So I'm kind of mentally preparing for that. But the tiny joy of it is driving my older two to the bus this morning. Some Elton John came on, and I'm a huge Elton John fan, and I feel like it's my job to like make them understand music that they would not otherwise encounter. All three of us singing Rocket Man on the way to the bus this morning in the car. And it just made me so happy. It's like just a tiny thing for me, but to share music, well, that was a big thing with me and my dad. And to have, through really osmosis, my kids have picked up not just an enjoyment at, being able to sing along. That was super joyful for me this morning.
I love it. I want to, what is it called whenever you're in the car? Oh, the karaoke, the car karaoke. What is that?
Carpool karaoke.
Carpool karaoke.
Oh, girl, it was before 7 a.m. I'm very glad. It was very cute. They were singing Rocket Man, and I was like, I am a proud mom in this moment. Yes. All right, let's dive in. Why are we starting with why? If you're not familiar with the concept, it's the idea of Simon Sinek, and it's a why, how, what framework that provides clarity and alignment for people, for groups, about that. Starting with why establishes your clear purpose, really helps you understand then the how, which is your strategy or process, and then the what's, the tangible outcomes. How do all of those things line up? And by doing it in that sequence, the why, how, what sequence, you're able to ensure that your actions and your decisions remain aligned with your core beliefs and objectives. It's one of my favorite personal exercises. It's one of my favorite exercises for teams. So with that, Spring Lane, I would love for you to introduce yourself to the Make It Make Sense listening audience for the first time and share your why.
Well, thank you, Kim Lynch. And now that we both have gotten our names out there, I love the starting with why as well. One of the things that I've learned so much from listening and reading Simon's work over the years is just, I got diagnosed with ADHD as a young person. I was 9, and I like to say that I was so hyper that I used to drive myself insane. Like, I used to annoy myself because I was like, I want to calm down and I can't, and everyone around me is annoyed by how hyper I am, and also me. I'm like, I'm in the group, y'all. I'm with you. But it took me decades to really like be okay with that being part of me, right? And actually honoring that part of me, because like my ADHD is also part of what makes me amazing, right? But this whole starting with why really helps me recenter, because sometimes I'll get excited about the how, right? I'll start on a project of the how because it's going to attach to the why, but going back to the why over and over helps me keep that course, because sometimes the projects are very big and you don't know how they're all going to unfold, and so you get down this path and it's like it's that real check back to, am I really going in the direction that I thought I was? Is the why still the why, right? And sometimes I get off course, and so it's just so helpful. And so I love that that's where we're starting. So this week has been kind of heavy. So I'm a family nurse practitioner. I've been a nurse for 20 years. I love taking care of patients. When I first had a friend, actually I sold insurance, and she said, I think you'd make a great nurse. And I was like, ew, I don't want to do gross things. Like, I'm an office person. What are you talking about? Like, I worked in banking before that. And I was like, yeah, no part of nursing sounded like what I wanted. But she saw that in me. And so, and then she started telling me about how I could make more money and these other things. And I was like, well, I'm a single mom and making more money is actually a great idea. And then she was like, oh, and you have kids, you touch the gross things with kids. And I was like, she's not wrong. Maybe I could do it. And then I got into a program. I started out as an LPN, and I got to start doing patient care very quickly. I loved it. I loved serving people. I loved being that person that they trusted. I loved being able to build relationships with people. It just immediately felt like the right fit. And I've loved nursing ever since. And over this time, I have had so many conversations with patients. So, family members, I have so many whys. This week has been really heavy, though, because I have a friend she's getting to the end of her battle with cancer. And I just want to share her story really quick. And I haven't gotten to talk with her. I know that she wants to share her story, so I want to let her share her story in her way. But just for me, watching my friend, right, who I met this woman about 12 years ago. And when I met her, she was this soft, everything feminine that I think is feminine, right? She's a mother of 5. She's married, and she's like always speaking positively of her friends and of her husband. And you never hear her complain. And she's soft, and she loves to sing. And she's just like, oh my gosh, like create this like perfect little flower of a human. And that is who she is. And, as soon as I met her, I was like, I want to be this person's friend. Like, I need to be around her because I want to be more like her. There's still a part of me trying to like be somebody that I wasn't. I'm loud and I'm take up all the space. And, I try to be considerate, but I forget about things. And, so anyways, there was a part of me that was like, oh, maybe if I just hang out with her a little bit, I'll like be more like her a little bit. And what I learned from being around her is she started sharing this thing or that thing that she was doing to grow, this book that she was reading. And I would read the books, or I would go to the conference, or I would do these different things. And I was finding all of these different things out, and it was helping me grow as a person. And then my oldest daughter went through a really hard season, and her husband were there for my kids. Being a single mom, one of the hardest things is not having a dad, watching your kids just long for that and not having anything to give them. It's so painful. And, you can try to show up the best that you can, but it's not the same. And her husband,
doing it on your own. I mean, I like going with the story. I did not mean to.
Yeah, no, you're good. It's just, it is. But it's like, it's that longing for a thing that you can't fill. It's like, I can't be your father. Like, no matter how much I love you and pour into you, I can't be that thing that you don't have. And like I said, her and her husband would show up for games, awards days, like birthdays.
Oh, I love the gratitude of that, right? Like that's someone showing up, and what a beautiful gift. I have a friend who immediately comes to mind as you're describing, like the magical, just spirit of that household. And I have learned to show up with a lot of gratitude to my friends who can create those beautiful moments. I'm like, that's not my special skill, but to love and appreciate a friend who creates that space, and to honor them and to learn and celebrate that generosity from her and her husband. Like, what a beautiful gift.
Yeah. Yeah. And her husband like has always called my kids his adopted kids, and it's been beautiful. And what's really, really amazing is whenever this season got really hard for my oldest daughter was the same season that my friend diagnosed with stage 4 cancer, colon cancer. And that was super hard, right? There's a young mom, late 30s, and gets diagnosed with colon cancer in stage 4. And my nursing brain is like, what? How? Like, here's a woman who's healthy and, takes care of herself and takes care of her children, and she's active and all of these things. And this didn't make sense. And so over the years, I have actually, and I know we'll talk more about ACOs as we go along, but, her primary care doctor was one of the doctors that I got to work with. And I can remember now conversations that I had with him about ACO measures and, meeting marks and, them wanting to be at the top of the charts, but also having the same conversations about, hey, this is what we need to do in order to be excellent. And him telling me, I'm just going for mediocre. Like, I'm just going for mediocre. And as I watch my friend struggling and all the points that the system has failed her, I think about all the times that I've had conversations with clinicians and they tell me, that's fine. I'm not trying to be anything but mediocre. Patients don't want that. There's not enough money in the system for that. That's not my job. That's that other person's job. And my why is because every single one of those excuses is unacceptable. Every single clinician that is practicing today that is settling for fine needs a wake-up call. We need to look ourselves in the mirror and say, am I doing what I said I'm going to do? Am I doing the things that I said? Am I honoring my commitment to my patient? Because my patient, when they're sitting in that chair, they are expecting someone who's showing up to the table who wants them well, who wants them vibrant, alive, worthy, liberated, all of those things. That is what they're expecting. They are not expecting mediocre. They are not expecting fine. Fine translates to them as vibrant, alive, worthy, liberated, headed on the right track. And so we have got to get to a point to where we are talking the same language, to where we are really spending time serving the people the way they deserve to be served. And we have got more than enough money in the system.
Tell us a little bit about what you're working on now.
Yeah. So a year and a half ago, I started my first clinic as a family nurse practitioner, Exceptional Wellness. And very quickly, actually, even before we opened, my heart was, I want to create a system that other clinicians can take and make wellness easy. Because having these conversations over and over, just hearing, that it's too hard, I don't have enough time, there's not enough money. And I'm like, it can be easy. I've had conversations with patients that literally were less than 3 minutes that have changed the trajectory of their health, which sounds insane. And, also sounds like I'm tooting my own horn, but I'm not. It's that small of an intervention to just take those couple of moments to make sure that you and the patient are on the same page. They understand and are educated, equipped, and empowered to do what you've asked them to do, right? And so I love that. And so as we've built this out, we've started actually doing consulting, and we're working on franchising in a couple of other states, because our hope is to have prevention providers be a part of the care for every single patient. Right? Everyone deserves to have somebody who has the time, the resources, and the skills to help them be exceptionally well. So that's what we're working on right now. And then, the thing is, the system right now is rigged against the people who are generous, trustworthy, who maybe don't have the same resources. I had a conversation this morning with an elderly patient who stopped me at the coffee shop. She went to see her primary care doctor and she had a pain. And she's very soft-spoken. She's had, different issues to where it's hard for her to speak up. So she literally can't even speak up very loud. And, she's on Medicaid and Medicare. And so it's hard for her to get in a visit. So she had to wait a while to get her visit. She gets in and she's telling him what's wrong. He basically is like, come back in a few months. It's going to be fine. A nice F word. And so 3 days later, she's in the hospital with an infection that ends up with a 4-day stay and over $3,000 in medical bills that she doesn't have the money to pay. And it's just like, this is not acceptable, right? We've got to set up the system to where people who have a hard time speaking up for themselves, we have time to listen to them. We have time to help them communicate with us what they really need. And then
time to do cancer screenings, and to follow up when patients represent themselves. That's right. We don't want a system that hurts anyone.
Yes. We want a system that helps people be exceptionally well. So Kim, I know that you have been just problem solving. You're such a Swiss Army knife of information and being able to help people get moving, right? I love that you're a master at momentum. So tell us your why. Why are you here? Why does this matter to you?
So for me, it comes from my own care experiences as a kiddo, quite frankly. I am the daughter of a doctor, and I grew up with my clinical experiences being kind of magical, Spring, very much like what you describe. I rolled in and got to see, Dr. Rob and Aunt Lonnie, and, he was the doc, she was the office manager. I got to twirl in her amazing desk chair, very, very important core early memory. And over my now 20 plus years in healthcare, that's what I've loved. That's why I work in healthcare as a non-clinician. I love creating that experience for others. And yet over that 20-year career, I've seen it's anything but that experience. And where I am today is really yearning for us to empower, especially the clinicians, to fight for justice for their patients, for themselves, because you know what it feels like. It's what you've described. I know what it feels like as a patient. We all get to hold that definition of what healthy feels like, what good looks like. And I'm a firm believer that our system is broken. I don't think that's a radical view at all. Where I am now is that it's actually very doable. I can see it for the first time in a very real way, that we actually can achieve sustainable balance in our healthcare system for all, for patients, for clinicians, for communities. And that feels radical, but that's what I'm really excited to accelerate, because I've done it, you've done it, we've done it in a bunch of different settings. Is it still really bad out there? Absolutely. But my why is I know what good feels like, and I know what it can look like at scale. And that is my why. I want to replicate that. I want to help people accelerate their balance, their definition of good as a doc, as a nurse, as a patient, as, quite frankly, a caregiver, to say, this is what thriving looks like in my community, in my definition, and that's sustainable. It's not, well, that's nice as long as you have, the resources. Well, that's nice as long as you have charity funding. No. This should be the norm. And that's what has me excited. I really do think that we're finally at that moment where there's enough clinicians like you, there's enough progress in the ecosystem where I'm really excited to just start accelerating the folks that are putting those points on the board for patients, for clinicians, for their communities.
So, Kim, can you think of a time where, I love what you were just describing about the hope is what I hear. There is hope, and it's not unfounded hope, right? It's not like just empty hope. It is like we see it and we know it is possible. Like, it is not a dream. It is real. It just takes putting the right pieces in the right place, and it is real. And so I hear that. And also I want to know, can you think of a time that you've talked with a clinician who felt hopeless, who felt like that can't be real? Can you help us? Because I know that not everyone has had that experience like we have, or we've heard those stories. So I just want you to help us hear that story.
I mean, unfortunately, have I stood with clinicians? Have I seen them in that hopeless state? Yeah, far too many times. In fact, I'm really glad that we're going to be talking about some of those examples here, because no one should get that close to the edge, not when you're, running a good clinical business. A larger discussion we'll have is how hard it is to run a good clinical business and how that game really is rigged against you. What I would say is that when you are working harder and harder and harder to serve your patients and not seeing more predictability, more firm ground underneath you, that's a cognitive dissonance that you can't easily explain away. And so you're right, you need specific examples. Where is someone actually making change in this system? The ones that I love are the independent primary care docs that I've worked with and have seen. Where they've started has often been the patient populations where they are most frustrated. So I love talking with them about their Medicaid populations, for example, because independent primary care docs, and I'm thinking of one in particular, in Kansas, they were determined to keep their doors open for their Medicaid patients and their whole patient panel. And that was what was at risk when they didn't have tools and support to keep an eye on their money. They were keeping their eye on their patients. They were an amazing, high quality, top-notch clinic, but it was on the financial side that if they didn't have someone adequate keeping an eye on those things, and the clinic nearly closed. And so for me, it's that it should be easier. It shouldn't be easy. It's not, no clinician is asking for it to be easy. No independent primary care practice is asking for it to be easy, but it should be a little bit easier. And it certainly should be a lot harder to fail if you are trying to do the right thing, if you are just trying to meet your community and the needs of your community. But we have made the game of getting paid in healthcare, for one. There are other games too that we will discuss, but the game of getting paid has been so hard that people take it on as a personal failing. I hear a lot of clinicians, and I'm this clinic in particular, the doc thought it was his fault. I chose the billing company. No, you relied on a reasonable business for a reasonable service, and one error should not sink your practice. That's not justice. That's not justice for your patients. That's not justice for your community. So to me, it is really starting with wherever you are as a clinic, and giving you a little breathing room wherever you are, and then realizing that it's not your fault if you are feeling that stress of I'm working harder, but it doesn't seem to be getting easier.
Yes.
That is that video game. That is that video game set on hard mode that I want to de-shame. I want to talk about that more here, because if we're going to make it make sense, it has to start with there is no shame here.
Right. I love, love, love what you were picking up on right now, because what I think about is, and so, I sometimes zoom in really, really close because, I don't know, that's just how I'm such a passionate person, right? Like, and I love to, maybe I'm a little dramatic too. So I like to have that passion turned on in me, and people fuel my fire, like people's stories fuel my fire. And like I go back to all of these different examples whenever I see a problem, right? Even in nurse practitioner school, whenever I was like learning different diseases and disease management, like I had to attach it to a person, which is like a horrible thing in some ways, but like I had to, in order to retain it or care about the subject at all, because it's like, if it's about a person, then I care. If it's not, I'm like, me. But it's like, I had to make it real, And so for me, what you're talking about, like you just picked up on something about billing, right? And so I can remember vividly having several conversations and like exactly what you're describing, talking to a physician who, hey, I went to med school. I was top of my class. I got out. I did residency. I was like top dog, did all the great things. And, not tooting their own horn, but like just
I'm capable as you are. Yes.
Right. They're reflecting on, I am a capable human, right? I am intelligent enough, or should be, right? In this system.
That's right.
To be seeing progress, right? And exactly what you're describing. But I can't make my bills. I am seeing more patients than is actually humanly possible. I'm not able to even listen to my patients. I'm not able to help them make progress. I'm giving them more prescriptions every month, every year, and I'm not happy with it, but I don't have anything else. And then on top of that, I'm being expected to document like 100 pages worth of information on every one of these visits. And I'm expected to like follow up with 3 or 4 different people for every one of these visits. It is insurmountable. And how is everyone else doing this? what's wrong with me is sometimes the question, right? Or why are we doing this? Why am I even still here? Because like, I'm obviously not impacting anyone in a good way. I've had one provider who's actually told me like, look, if I were to grade myself on my population, right? My ACO, my quality standards, they may say I'm doing good. But when I look at my people, a hemoglobin A1C of 9, not acceptable. Not acceptable. My patient still has diabetes. They're still damaging their kidneys, their eyes. I don't want that for them, right? So that's not acceptable to me. And so when I look at my patients and I'm having to get them 3, 4 different medications, they're coming into me month after month complaining of more complications and more side effects, and their quality of life is going down. I judge myself as a C at best. And that feels awful. When you talk about the moral injury, right? It's not a numbers game. I am looking at humans who are deteriorating slowly in front of me, and I have nothing to offer them. And I can't even listen to them. I'm going to run out of the room.
I have to keep going on to the
make it okay with me.
That's right.
To do that to them, to have it be a transaction. I can't really care, because if I invest enough to care, then I already can't pay my bills.
That's right.
It's an impossible situation. So when I think about that, of what you're saying, it's like, and then to be outside of that and be able to be like, hey, guess what? It doesn't have to be that way. And they're like, I don't understand. What are you saying? It doesn't have to be that way. And they're just so busy doing the thing that it's like, okay, let's just take a 5-minute pause.
That's right.
And
this is it. Money and lives. To me, we are very well equipped in most ways, not all ways, to measure the money side of the scoreboard. We are terribly ill-equipped to measure the lives and the health or harm we are causing. We have some instruments for that, but to me, it can be that simple. Money and lives, and you're saying it perfectly. The other thing about lives, and we talk about this, is your time is your most precious resource. As a human, it's true for all of us, but especially as a clinician. And I think that, where is my time going? And am I able to make a little space for creativity? Am I able to make a little space for understanding new payment models, new care models, what might be closer to alignment for how I want to practice, how I want to see my patients, how I want to show up in my community? That's really what Spring and I are on a mission to help do. We want to break up the ice, so to speak, of last century's healthcare system that we all agree has been terrible. Really, it's about breaking up that ice, because there is water underneath to start moving and accelerating all boats, all efforts towards the health system of this century that is more just, that is not choked off on innovation, but is actually thriving in innovation in our most erudite institutions and with all of our practitioners in the field, because y'all are killing it. More to come there.
Yes. I was going to say, I know we've got like a very long list of topics that we plan to discuss. We have so much that's like just been bubbling out of us. And I'm so excited to do this podcast with you, because it's like, I think about like some of the things that I'm involved in, like the biohacking space, right? And the things that are, the people who are like a little bit more on the front end of like, let me try it, maybe before there's research to show it's maybe not unsafe, right? But nothing that we really know yet about what it can do as far as treatment goes. And they're willing to like step out there and try a thing. And that's really fun to watch, right? And to be an observer of, and to see what can be used in different things. And then, there's this whole space of, like what I'm doing, where we're doing like membership-based models. And, I love like just this week with this thing with my friend and other things, like our community of members coming together, and like, we have a community fund, right? And then we have other members who are like sharing those burdens together. And it's like, I want to help take care of this person. It's like, that's how it should be, right? Building community.
Network effects, baby, right? Yeah. Literally, that's it. This is what happens when people can see the benefit of their own effort. And that is transformative. That moves mountains.
Yes, I love it. And I know we're going to talk about, value-based care models and all these different things, and how to there's a lot of ways you can optimize even fee for service. A lot of people are like, that's not billable with insurance. And I'm like, oh, baby, it is. I'm not contracting with insurance because of the way I am, but it can be if you're already doing it. I'm like, we can help you. And it's just so fun to think about all the ways that we can move forward, right? Because it's kind of back to that whole anthill thing of like, it doesn't have to be, and never is it a straight line, right? It's like, okay, you like the higher, you like the lower, you like the left, you like the right. I don't care. It's cool. If we're all marching in that direction of alive, worthy, and liberated patients, right? Our system, everybody there, then awesome. Like however we get there, we get there.
And to us, it's about unlocking those first steps of know-how, those first steps of inquiry, finding your coalition of the willing, like Spring is describing. They're out there. We want to help be connectors, accelerators, all of those positive things, because we know that we are not the only rebels out there wanting to accelerate this transformation to a more just healthcare system. All right, so as you've heard, we are clearly on a mission to accelerate the transformation to a more just healthcare system. Let us know what we should try to make sense of next in the comments, or where you have questions from today's episode. We covered a lot, and we really want to hear what direction you'd like us to take this in.
Yeah, I love it. So one of the ways that you can tell us about what you want to hear is, so the Spring lane. So, we got the fast lane, the slow lane. Spring's a little magical unicorn over here who is actually making it make sense. And so you can go to the Spring lane and you can put in your topic of what you would like to see there for us to help bring light to. What is it that you're curious about? Even if you've been noodling on it, you're like, there's got to be a way, but you don't see it. Let us talk it through with you. Like, it's so much fun.
And what's that website again, Spring?
thespringlane.com.
Thank you, Spring. This has been so fun.
Thank you. Yes, it has been so much fun. I love you.
Take care, y'all.
Thank you so much for joining us on Make It Make Sense today. I hope you enjoyed this. I hope you got something that you can take and actually use in real life. I hope that you want to share a tiny joy with us. And if you do, please go to makeitmakesense podcast.co, because we love hearing your stories.